Welcome to Transcultural Nursing. My name is Serene Lin. I picked Leininger's Transcultural Nursing for my nursing theory slide presentation because of my background and the patient population I was working with in the United States. I truly believe that people from different cultures act differently and have different needs, care expectations, and respond differently to the same medical care. Dr. Leininger put nursing and anthropology together to coin the term transcultural nursing, which addressed these differences. Dr. Leininger was born on July 13, 1925 in Sutton, Nebraska. She earned several degrees, including a doctorate in philosophy, a doctorate in human science, and a doctorate in science. Dr. Leininger was the first professional nurse with a graduate degree to go on to complete a PhD in anthropology. She was a living legend and a distinguished fellow at Royal College of Nursing in Australia. Between 1954 and 1960s, she began the first graduate program in psychiatric nursing at the University of Cincinnati, as well as the first clinical specialist program in children's psychiatric nursing in the country. During this time, she also co-authored one of the first psychiatric nursing texts, Basic Psychiatric Nursing Concepts, which has been published in 11 languages as used worldwide. In 1973, under her leadership, the University of Washington was recognized by the Outstanding Published Institutional School of Nursing in the United States. In 1975, she became the first full-time president of the American Association of Colleges of Nursing and one of the first members of the American Academy of Nursing. In 1990, she was president with the Women in Science Award from California State University. She facilitated the certification of transcultural nurses, CTN, for client safety and knowledgeable care for people of different cultures. Dr. Leininger's idea of creating this theory came from the time when she was still a clinical child care nurse specialist in child guidance home in Midwest City. The children that she was worked with were from different countries, which she saw made them respond and behave differently to the same care she delivered. After World War II, many new immigrants and refugees were coming to America, and the world has becoming more multicultural. Even now, as people travel all over the world, nurses in all countries have a bigger chance to take care of patients from other countries. Dr. Leininger declared that care is the essence and central domain of nursing, and it needs to be specific and appropriate to different cultures. The main purpose of transcultural nursing was to use research-based knowledge to help nurses discover different care value in practice. We can also use this theory in safe and meaningful ways to care for patients from different cultures. This theory not only works well for patients, but also can guide healthcare providers in the care of clients, families, and groups of people from different cultures. Why is transcultural nursing theory so important? There was clear evidence in the 1960s that people from different cultures were not receiving the care that they wanted, which should included their expectation, cultural beliefs, and values. Dr. Leininger took a leadership role in this transcultural nursing and created educational programs that taught nurses culturally safe and congruent care practice. The Sunrise Model. Dr. Leininger created the Sunrise Model to help people understand her theory better. The upper half of the circle included the components of the social structures and worldview factors that influence care and health through language and environment contexts. The middle part of the model are factors that included folks' professional and nursing system. Putting these two halves together into a full sun represent the universe that nurses must consider to appreciate human care and health. There are three major actions and decision guides to provide culturally congruent nursing care. The first one is culture care preservation or maintenance. The second one is culture care accommodations or negotiation. And the third one is culture care repatterning or restructuring. Some of the major concepts of this theory are transcultural nursing, human care, caring, culture care diversity, and culture care universality. Transcultural nursing is a study of culture to understand difference between human groups. Culture is also learned by each generation through both formal and informal life experience. For example, after mothers deliver back in Taiwan, we will stay in a baby care center to take care of both mothers and their infants. So the whole family gets to adjust their new life with some assistance, which is totally different than people who delivered here. Other major conceptions of this theory are environmental context, emic, ethic, religion, ethnic, and worldview. With the transcultural care theory based on emic beliefs, a person gets close to the discovery of people-based care. An important purpose of this theory is to document, know, predict, and explain about generic and professional care of the culture being studied. The major assumptions were derived from Leininger's works on the theory. Caring is essential for well-being, health, healing, growth, and to face death. Culture care helps predict nursing care phenomena to guide nursing care practice. Caring is also essential to caring and healing. There can be no caring without caring. Culturally congruent nursing care can only happen when the patients and their families' values are known and used in meaningful ways by the nurse in her interactions with these people. Patients who experience nursing care that fails to include their beliefs and values will likely show signs of non-compliance, stress, and moral concerns. A critical need remains for nurses to be educated in transcultural nursing in undergraduate and graduate programs and for faculty knowledgeable in transcultural nursing to teach and guide research in nursing school within the United States and other countries. Although the society demands for transcultural nursing is evident, there are still inadequate research funds to study transcultural nursing education and practice. This theory focuses on culture care and uses a research method called ethno-nursing to examine the theory. Besides Leininger's study, Other studies have been conducted and building on her ideas and take her theory to new dimensions. The Transcultural Nursing Society was established 40 years ago. It has contributed to the health care of people from many different cultures. The TCN Society has had a major impact on beneficial service